Marketing Made Easy by SRJ Marketing Communications and Easy Healthcare. And it's a program that I think that you're really going to get a lot of value from. And so I'm glad that you're here and glad we have the opportunity to visit together. A little bit about SRJ Easy Healthcare. It is a service line of SRJ Marketing Communications. And it will become pretty obvious as we go through the program the amazing amount of benefits that are gained by this particular program. This is one of them, so I hope that you're just as amazed as what I am, I guess. But I'm glad that you're here, and I'm glad that we have the opportunity to cover our topics today. The purpose of srjeasyhealthcare.com is to give small and rural community hospitals the tools that they need and the education they need to have a good, solid marketing program. I'm not going anywhere. I'm still here and still available for full services and help you with your marketing programs. But sometimes you just need some things done internally. Some of you have the benefit of a community relations director, and I believe that the community relations director should be great in the community, but they're not necessarily gifted and talented in graphic design and writing press releases, even the strategic side of things. So that's what SRJ Easy Healthcare is about. Well, marketing is not a choice, but what you do to decide to do really is. And so you have the opportunity to really take a look at some of the choices that we're making in our marketing programs and make some new choices along the way. And so I'd like to kind of go over that a little bit and help you plan for your second quarter of the marketing program during this presentation. Many of you on the call today have heard for a long time my expression, marketing is the sum total of all impressions. And this is an important fact that I just want to really kind of emphasize. Everything that we do, whether it is an ad in the paper, a press release, an open house, even the entry when someone walks into your rural health clinic and they see a lot of do's and don'ts and papers on the walls and papers on sliding glasses, windows and that sort of thing. Those are all things that form an impression. So many of the hospitals have these beautiful, wonderful lobbies and fabulous facilities. And then you walk into a particular department or down the hall and you have Xerox signs that are leading people down the hall or to the next department or something like that. Those are forming impressions. And I want everything that we do for our rural hospitals to have a look and a feel that is just exactly the delivery of the healthcare that you provide for your team members and for your patients and family members, I should say. And that's what we want to focus on is what is it that the patient and the family member sees. For some reason, it just popped in my mind. I walked into one hospital several years ago, and the restrooms were right after the reception area. Walked into the restroom, and there was a cockroach in the urinal. That is not the kind of impression that we want to provide our patients and family members. So marketing is the sum total of all impressions, and we want to really work together to coordinate those. Now, I believe in a very integrated approach to marketing, and what I mean by that is these are all, or some of the tools, they're not a complete list, but they are some of the tools that we use in an integrated program. Social media, critically important for the smaller rural hospitals if it's done correctly. If it's not done correctly, it can be a disaster or just simply not paid attention to. And by the way, if you're not using social media and to its full advantage, then I really want to encourage a phone call and let's explore what's up with that. Public relations. It is said in my industry, the marketing and public relations industry, that a newspaper story is worth about 4 times what it is that you pay for the advertisement. So if you pay $100 for an ad and you have a similar size story in the paper, then that press release, that story in the paper is worth $400. So and it could have a value that's even higher than that. Industry standards are 3 to 6%. The point is that when people are reading something about you and your team members, they form a different opinion. First of all, it's part of the paper, and so they believe that it is written by the newspaper. In some cases, it is. In cases of my clients, it's usually stuff that my staff writes on and submits it to the paper. Over the last 28 years of being in business, I would tell you that I'm just guessing at this percentage, but I bet you that 90% of every press release that I have written and submitted to a newspaper has been published by the newspaper. They really like it, quite frankly. The beat is covered, and they really enjoy the fact that they have this wonderful opportunity to have ongoing information coming from the hospital, and they don't have to worry so much about it. So I really want to encourage you, if you do not have a strong public relations program, public relations, in this case, I'm just speaking of the press release to the newspaper. If you don't have 2 or 3 of those going out every single month for a weekly paper, and 5, 6, 7 of those going out for a twice weekly paper, if you're not doing that kind of aggressive public relations, press releases to the newspaper, then you're really missing out on one of the key components. Those 2 elements alone, social media and press releases to the paper, you should be at the very cornerstone of your marketing program. Websites, we've been using websites now. SOJ Marketing Communications did its first website for a hospital in South Texas in 1995. And we were kind of early adopters to that and created that website very early on. But now they're just kind of just part of our life, quite frankly. And you can bet your bottom dollar that people are going to your website to find out something about you, to make an appointment, to make a call to you, to look at a picture of the doctor before they go to the doctor for the first time, to find out what you have available. If you're delivering babies, they want to know about that, and they're going to look for all kinds of information. So your website is a really critical factor. And if your website doesn't look like the websites in the big city hospitals, I'm sorry, but people are forming an opinion about your capabilities. If you have an old, clunky website that's just not functioning, not working, and not modern, then you're really missing out on some opportunities here. So that website becomes an important tool as well. Collateral material, collateral material doesn't have to be expensive, but it does have to be good. It has to be a good design. It has to have a good feel and a good look. It has to match everything that you're about and doing. So a good design is really important for your collateral material, and I want to encourage you to make sure that it's well printed. Don't be sending a good design over to the Xerox machine for printing. It's just not the way to do that. It's just not going to be received right. Remember, marketing is the sum total of all impressions. Our interaction with the community, we need to be out there. That's another thing that I'm really big on, is getting involved with the community and staying involved, hosting the events at your hospital, making your dining room available for meetings or your boardroom available for meetings. Sales, yeah, this day and age, we need to be selling, and we're going to talk about that here in just a moment with swing beds. And by the way, swing beds is next on the agenda here, because some of you are here just for that segment. So sales, yeah, we need to be selling. We need to be letting people know that we want their business and we care about their business. That's an important thing. And of course, advertising. We know about advertising, but we don't always know about what it is that I'm going to tell you right now, and that is the advertising needs to be spot on. It needs to be clean and crisp and designed well. It needs to be, the look and feel needs to be consistent. Having a new design in every weekly paper just is not going to cut it. So we need to make sure that the advertising is good quality materials and parallels what it is that we're doing on social media and what it is that we're doing on public relations and what it is that our website looks like. It all ties together. Unfortunately, sometimes it looks like this, doesn't it? So where it just is all sort of scattered, and that's where I want to kind of bring it back together, bring it together so it looks like a cohesive marketing program. And that's what SRJ Easy Healthcare and SRJ Marketing Communications is about. Exposure equals awareness equals sales. The fact of the matter is that people make new decisions based upon new information, and we want to continue to have this conversation with our community. So there's all kinds of different advertising, and we wanted to have with some focus to it. Are we going to talk about our profit areas and service lines, such as swing bed and physical therapy and our rural health clinics and lab? Or are we going to do image advertising, service lines? Are we going to have a testimonial campaign, feature our medical providers, our team members? There's all kinds of things that we can do for our advertising. But what we want to make sure that we do is to make sure that we have focus to the conversation. So SRJ Easy Healthcare is bringing that focus, and people, as I said, make new decisions based upon new information. And so we want to give them the information they need by providing a consistent, constant message. And we can do that through a variety of different ways. First of all, if we're interacting with our community, then we have the opportunity to, in a casual sort of way, talk about what it is that we're up to. The Lunch and Learn programs, very, very successful to have these programs. And it doesn't really matter, quite frankly, if one person shows up, or 10 or 15 or 20. If you and your medical team have the abilities and the skills to teach it, you probably have the ability to do it, right? So when we are advertising it in our social media programs and sending out the press releases and educating the public through an ad and inviting them in a variety of different ways to come to the Lunch and Learn programs, it's wonderful when people show up, and we certainly want to have them show up because we can give them the most amount of information. But we have hit a home run even if no one shows up. And I'm not advocating that no one shows up, because we need to keep our providers motivated and excited about it. But if you're not doing a Lunch and Learn program, it may take a few months to get that geared up and get the attention drawn to the program, so you have a consistent audience. But it's a wonderful way to communicate with the community what you're doing. So let's postpone. Normally I would jump into the marketing program. So we've got some marketing folks on the line with me today on our webinar, and they are responsible for lots of things, quite frankly, as rural health care is famous for. Marketing is sometimes done by the CEO or the administrative assistant or the radiology director, or someone has taken on the role of marketing. And rarely, in my experience, is there a marketing person on board in rural hospitals. They usually have multiple tasks. If we do have the opportunity to have a community relations person who can get out there and be in the community, that is a great thing. And so if you have a question about that, let's visit about that. But I want to talk about swing bed first, and I think it's always good to get the most important part of that conversation started and kicked off with, which way does a bed swing? Does it go this way or that way? I've had people tell me that that's exactly what patients and family members have said when we've started talking about swing bed. They're a little confused on what that exactly is. And so we have an opportunity to, through dialogue and conversation, to educate them on this program called Swing Bed. And I would say that the first thing you ought to do is to consider calling it something else. Swing bed is kind of an internal conversation. It really doesn't mean anything to patients and family members. So maybe it's a recover close to home program, or it's transitional care, or it's skilled care. So that's the first place I wanted you to kind of focus on for just a moment. Is there another name that might be just a little bit better for our swing bed program that we might be able to use in our conversations? Give that some thought. Well, swing bed is worth a lot of money to some hospitals. So I don't know how much it's exactly worth to you, but I've got a slide here in a little bit that breaks it down. But it's an important program for our rural hospitals, and it's worth a lot of money. And I think it's also an important program for our patients and their family members. So it's really worth the time to really concentrate on it. So I think we're going to need to have some basic things when we talk about our swing bed program. We need a brochure of some kind that we can give to our family members. A press release would be good. I think there's a opportunity to talk a little bit about our swing bed program in the newspaper, although most everything I'm going to talk about from here forward is going to be unrelated to the general public. But having a press release handy, I think, is a good thing. If you're doing a newsletter, this could be something that we do, is put a article in your newsletter, and maybe an ad. Probably not, quite frankly. It's not a consumer-related conversation. It's one that we want to raise awareness of and have a dialogue about. And sometimes we might use some of these tools for creating that conversation. Sometimes, if properly done. But swing bed, all happens in conversation. It all happens in conversations, and we need to start having those conversations. We need to promote it, the brochure and the ad, but we need to talk it up. We need to be talking about this particular program. And two places that come to mind are the Senior Citizen Center, if you've got one. That's a great place to go out there and have a program and to pass out a brochure. Same with your Ministerial Alliance group. Great conversation to have. These folks are influencers. Think for a moment, Senior Citizen Centers, by the way, are a real source of information. If someone is involved in the Senior Citizen Center, they go to the luncheons and involvement and that sort of thing, chances are they are an influencer. I'll bet you they leave the senior citizens and they go volunteer someplace. And I'll bet you that they are involved with their place of worship. I bet they may still serve on a committee at the chamber or in a social group of some kind. They're moving around. They're involved, and for folks at the Senior Citizen Center to know about your programs and what you're up to is a great source of information out into your community. The other place is really, really important, and I know we've got some CNOs and DONs on the call today. At the time of transfer. Now this is where this goes way off the traditional marketing, public relations, advertising, social media. And I think this is where it's the key component to being different and to getting folks back is at starting with the time of transfer. But let me go with this side a little bit. These are some other folks that I think that you should be talking to, the Ministerial Alliance board members. This summer I was being told a story of a board member's mother that was talked into a swing bed program in another city. The board member's mother, and there was no convincing mom and dad to come back to the local hospital. Oh, we're already here. It's going to be okay. And so dad and family members had to drive an hour one way and an hour the other way to go and see their mom. And that, I think, is where the conversation begins. We really, from a nursing standpoint and from a hospital standpoint, we really don't want our 65 plus for sure, 65 plus members of our community having to get on that dangerous highway. And I use that word a lot when I'm teaching this program. That get on that dangerous highway going back and forth to the bigger hospital. There just isn't a need for that. And when we can offer this service home. But you know what? And this is the sales part of it. When they get to that larger hospital for that hip replacement or whatever it is that is going on there, you can bet that they're selling them from the day they arrive on using their program. They know exactly how they're going to get them into their particular program, and we need to be proactive. You know, the fact of the matter is, they are your patients. They're your patients. And so let's begin the process by, at the time of transfer, for instance, we begin the dialogue where we can say, you know, you're probably going to have a hip replacement or you know, whatever the procedure is. But there's going to be some recovery time. And I want you to know that you can recover right back here in your local community. Now, you know, if you're talking to a family member, now let's take care of your mom right now. But, you know, before they start talking you into, you know, staying in XYZ city for the recovery for, you know, 2 or 3 weeks, just know that that's available. And here's my card. Here's a little information. And this is done by the nursing. This is done during the time of the transfer. As appropriate, of course. I mean, obviously we want to take care of the patient first, but that conversation begins, and the next day, I mean, if you're talking to a family member, you might not be able to you know, call the patient the next day, but if you're talking to a family member at the time of discharge, and so therefore they're in the loop from a HIPAA standpoint, you know, now we can call the family member and talk to them. You know, how's it going, and be their friend, and lead them through the process, and let them know, just like that board member's mother, mom, the board member didn't get there in time, and mom was talked into it. So let's make sure that we're having, you know, conversations with the family members and the possibles with the spouses and the patient to let them know that recovery can take place right back in our facility. And you know, as appropriate, on the second day or the third day or the fourth day, whatever it is, keep up with the patient. They're your patients. And again, from just a human dynamic factor, we really, it's not just chasing the money, although I think there's big money here, but we really want to keep up with the patient. We do not want, you know, that 80-year-old spouse to have to be driving down the road and back and forth in order to be with their loved one. And the rest of the family as well. So I think we owe it to the patients, we owe it to the family members to make sure that we really do take on and absorb this idea that these are our patients, and we got to keep having that conversation. We want to also have the conversation with the referring doctor. You know, where did that patient, how did the patient get out of your facility? And we want to look at that. We want to make sure that whoever we referred the patient to, from the hospital, the discharge planner, and the social worker, to the referring orthopod that we referred to the discharge team at the hospital, we want to be asking for our patients back. We want to make sure that they know what we're up to. Now, by the way, if you've got a community relations director, this is where they need to be spending their time. They need to be out in the field talking to orthopods and talking to hospitals and communicating with the discharge team at the local hospital where you're sending your patients. This is where the money is to be made from a healthcare standpoint, not sitting there struggling to write a press release, which is, by the way, in the toolbox of SOJ Easy Healthcare. But this is what we need to be spending our resources on, human resources on, is interacting with the big city hospital and making sure that they know about our capabilities. And I think that, of course, you know, they'll quickly send you patients that don't have any insurance, and they'll certainly get those back to you real quick. So they have your number, but when I tell you that there's some sales here, that's exactly the case. You know, they've got your number when they need to send you a patient back that doesn't have any insurance, but they somehow misplace it when the need is there and there's an insurance product. So you need to be keeping up with your patient. I can't express that enough. Making sure that we talk to everyone in the loop there. This is where the collateral material, by the way, comes in. I experienced this summer, another hospital that I was talking to, they sent a postcard, one, which I don't normally recommend, by the way, one postcard to the discharge planners at a hospital, and they received 3 swing bed patients within just a few short weeks. 3. That was from a postcard. Exposure equals awareness equals sales. Exposure equals awareness equals sales. So, here again, sending out a postcard, picking up the phone and calling, reminding them of our capabilities, having conversations with folks to make sure that our patients are being returned to our local hospital. These are the kinds of things that are going to make a difference. Well, I don't know how much value it is for your hospital. I heard in the field that it's anywhere from $500, $250, $500, $1,000 a day. And so these are some numbers I just put together to look at the impact. So if we can get that average to 8 patients a day, maybe you need 16, maybe you're at two right now and would double it to 4. But whatever the numbers are, plug those into that little formula. Those are some big numbers. I mean, almost $1 million in new revenues, plus some tests that wouldn't normally be or that would be lost, or admissions or readmissions in particular. Community relations, I mean, like the relationships that you're building with mother and dad and brother and sister and aunt and uncle that are coming to visit in your hospital. So there's some big dollars here, some really big dollars here. And this is where we need to be focusing a lot of our attention from the marketing desk. And this is going to be a change. Now, I don't know, we're kind of used to change in healthcare these days, but no one really embraces it. But when you start asking your team members to have conversations about swing bed at the time of transfer, that's different. That's different. That's going to require some coaching. When you start asking the utilization review or the discharge reviews to take place on a daily basis versus a weekly basis, because I really think that someone needs to look at those charts of transfers every morning when they come in, and someone needs to start picking up the phone and calling. This is where, I mean, these are, I don't know what your numbers are, but if these numbers are, I mean, half of that, the hospitals I work with, if that was cut in half, it would be pretty good. And if it was cut in half again, it'd still be pretty darn good. So, whatever it is, I think that we need to really pay attention to the education and the training that people are going to need in order to have the conversation. And that's what it's about. Next webinar is on March 20th at 10 a.m. I want to invite you to attend. And if this is your first webinar, you get to attend again before you need to make a decision about SRJ Easy Healthcare. So, write it down, March 20th at 10 a.m. And what do you bet I remind you once or twice or 3 times with an email? You suppose? You're right, I will. If you do have a question, you want to talk to me personally, there's my contact